students all over the Bay Area are getting ready to go back to school, obviously, here in less than 3 weeks. And what better way to show up to the first day of class with nice, smooth, clear skin? We're joined by a dermatologist here. This is Dr. Seth Forman. He's been with us before talking about acne. And this is a big problem for lots of kids, yeah?
Oh yeah, a very big problem. And it's not just about the skin, it's about how these children feel about themselves.
Absolutely, absolutely. It can be, well, you could feel very demeaned by the breakouts, the pock marks, everything that comes along with that.
Absolutely, and it's not just something that occurs during your teenage or childhood. I mean, if you have scars, that can be for a lifetime.
Yeah, self-esteem could be a tough problem. So are there some myths out there? I mean, you hear sweating, you hear about certain foods, eating chocolate, candy, sugar, things like that. It actually attributes to acne. Is that true, or is that just...
Well, I don't believe that sweating, I think those really are myths. Okay. Sweating, milk, chocolate. I mean, it's not a good idea to eat a lot of chocolate, but it's not going to cause your acne.
Okay, very good. And products. Back when I was a kid, there was what, Clearasil, Oxy 10. Now they've come out with Proactive, things like that. What do you recommend for kids to be able to clear up their acne?
Well, those are very good over-the-counter medications. Okay. And when I say over-the-counter, I mean you don't need a prescription to get those. You don't need to see your physician.
Correct.
But there is a time when those will not help anymore, and you will actually need to see a dermatologist.
At what point won't those help?
Well, if you have acne if you are using these products for maybe 6 to 8 weeks and your acne is not clearing up, well, it's time to get something prescription strength.
Okay, and so you brought a few things with you. Is this what you like?
I did. Actually, I do like this. Actually, this one's called Atrilin, and actually this is like a Retin-A type product.
Okay. That's powerful
newer
stuff. That will dry you out.
Retin-A, actually...
It's for wrinkle cream, isn't it? Wasn't it?
Well, wait a second. That's a really good point. Actually, Atrilin is actually one of the newer generation ones, and it actually has hyaluronic acid in it. So therefore, it actually doesn't dry you out. This is one of the brand new medications, and that's why I brought it with me today. Right. And to be honest, this is the medication I use on myself.
Really?
Right, but there is a very, very potential side effect to this medication, and I think some of these middle-aged women should hear this. This can decrease wrinkles and fine lines.
Oh,
so
no.
Beware.
Oh, no.
Yes, beware.
You realize you've just done, what is this called?
It's called Atrilin.
Atrilin is just, the stock has just gone up greatly on this. What else did you bring with us?
Well, I also brought, because sometimes you need an additional, for sort of that more severe acne, if you don't want to go to the oral medication, sometimes you actually need to use like a topical antibiotic.
Okay.
And this actually combines benzoyl peroxide with clindamycin, two of the topical antibiotics we like to use for acne. And a lot of times I'll use these two medications in combination.
Okay.
I'll prescribe both.
And I've heard this real quickly. Don't use soap. Just use just water.
Well, that's true.
The face.
Well, it depends. Sometimes soap actually can be very, very harsh to the skin. Right. There's actually non-soap cleansers that patients can use, or patients or people in general.
All right. Doc, thanks very much for the advice, and hopefully we're sending the kids back to school with cleaner, clearer skin. Thank you very much. Let's head over to